Better Buildings for Humans is powered by Advanced Glazings, makers of the Solera line of products. Solera is the leading glass glazing made specifically for architectural daylighting and with extreme insulation performance. Learn more at advancedglazings.com. Hello, and welcome to this week's episode of Better Buildings for Humans. I'm your host, Joe Menchefski, and this is the podcast where we explore the impact that the built environment has on our health, our wellness, our productivity, and our general joy of being alive. And we always talk about sustainable design as well. And today I have Emily McGee joining me from Meadows and Ohly. Emily, welcome to the show. It's wonderful to have you here.
Hi, Joe. Thanks so much for having me today. I'm really looking forward to the conversation.
Yeah, me too. This is going to be fun. Emily does some really interesting things involving the design and maintenance and management of medical facilities. But we always start by learning a little bit about our guests. So we're going to start there. First of all, tell us why you chose to become an architect.
Okay, well, my path has been anything but linear, and I think that's what makes it interesting. So I grew up in the Midwest. I was always fascinated by how spaces shape our lives, not just aesthetically, but fundamentally, and that curiosity led me to architecture, which is a profession that has blended, I think, a multitude of passions together, like art and history, sociology, science. But what I always felt like is that there's something kind of deeper than just designing buildings. So it wasn't until I was in architecture school that I realized I really wanted to focus specifically on how design impacts health. And I did my master's of architecture and health at Clemson University, which was really formative. Clemson is like one of the few programs in the country offering a very focused education on healthcare design and architecture. And then after earning my degree, I was selected as a Global Health Corps Fellow. So I worked with the Ministry of Health and Mass Design Group over in Kigali, Rwanda, to develop their national health infrastructure standards and 2 district hospitals. And so seeing how design decisions directly impact health outcomes, especially for underserved populations, that's when everything kind of clicked for me. And when I returned to the States, I kept asking, how can we measure the health impacts of our design decisions? And that question really led me to pursue a Master of Public Health and kind of allowed me to sit where I am today at Meadows and Ohly.
Well, tell us where you sit at Meadows and Ohly. First of all, tell us what Meadows and Ohly does, just to make sure everybody understands. Sure. And tell us what your role is there now.
Yeah, so Meadows and Ohly is one of the top 3 healthcare real estate development firms in the country. I'm in a really unique position there where I can influence health systems' strategic decisions, like before architects or designers or engineers even get involved or a single line is drawn. So we're talking about capital allocation, network optimization, and facility strategies that affect how millions of people access healthcare. And we're not just developers. We're kind of a comprehensive, I like to think, strategic partners to our health systems that we serve. We do everything from strategic advisory to master planning and development, which is where I sit. We do brokerage, program management, real estate services. So it's pretty comprehensive. And it's cool that we manage a portfolio of about, I think, 17 million square feet. And I think we serve well over 30 hospital systems. So as a senior director of planning, my role is to help the systems make strategic decisions about their portfolios and their real estate. So I help health systems answer critical questions like, where should we invest our next 100 million? How do we optimize our existing care network to better serve our communities? And are there gaps in our network? If we do plan for population health trends, like what are we seeing in 5 to 10 years? So it's really exciting. It's a fun place to sit. And what's powerful about Meadows and Ohly is that we're having these conversations at, executive level boards and C-level suites. So before architects are normally even engaged. So I recently did pivot into this space to help shape the strategy at the highest level, which means I can help influence health equity and access to care and community health through evidence-based planning. Meadows and Ohly is great, and it's been a fun ride so far being here.
That sounds amazing. I don't suppose you have a lot of boring days, Emily, in a role
Nope.
like that.
Very, very busy, but very exciting. So.
Yeah, what a wonderful position to be in. All right, so let's talk about the differences, right? So when you're designing an apartment building, an office building, a community center, there's different things that you have to pay attention to. Tell me what the differences are. Tell me about, just broadly speaking, the differences in designing, a medical building, a healthcare facility.
Yeah, Joe, that's such an important question because healthcare facilities are probably the most complex building types I think that we design. Maybe airports are up there too. But
Right.
when you're designing a school or young in your career, it's not many people that think like I'm going to go design hospitals, but they are very complex. And I would say versus other building types like apartment complexes or maybe some retail facilities, the first big one is the regulatory complexity, right? For healthcare is incredibly regulated. We're designing to FGI guidelines, NFPA life safety codes, of course, ADA requirements, infection control standards, and then there's the state and federal specific codes layered on top of all the requirements that you have just for a building. So, an office building, of course, has codes to meet, but healthcare adds like an entire different framework from the regulatory perspective. And, unlike an office, maybe where people sit at desks, healthcare facilities have like this tremendous support of complex workflows. So, clinical workflows. Think about like an operating room, you have a sterile and non-sterile zone, you have specific HVAC requirements, equipment needs, staff and patient flows. One design decision that you make can affect like all the surgical outcomes, infection rates, efficiency. So, that's to me is like the most complex and the biggest difference between typologies. And then I think, maybe the acuity, the vulnerability of people that you're designing for. I mean, people use healthcare facilities at their most vulnerable. They're sick, they're scared, sometimes they're obviously in pain or dealing with medical crisis. Of course, you have happy things like birth and joy, but most people interact with the health system and it's this very stressful situation. And so that type of design requires, I think, a level of empathy and thoughtfulness that is different. Hospitals are never closed. They're like mini cities, right? They're 24/7 operations. They serve as a fail-safe location for any natural disaster, an event. So, it's that constant power can't fail, HVAC can't fail. That redundancy and resiliency is very critical. But here's, why that's exciting. I think all these constraints push us to be better designers, right? A lot of people might say, oh, that regulatory red tape or all these constraints are hard. That makes design hard. But I think that it forces you to think holistically, not just about aesthetics, but about performance and safety, resilience, human psychology, and operational efficiency. So that rigor, I think, is challenging for designers overall compared to other building types.
Okay, I have two questions to follow from that. So the first one is, do you have a process like built into, like, do your designers have a process? Do you have a template or guidelines or the great book of healthcare design that helps you to make sure that you've taken into account all those multitude of things that you just spoken of?
Yeah. So I would say, for those who haven't heard of it, a lot of healthcare designers consult what's called the Facility Guidelines, FGI. That's kind of the fail-safe, most comprehensive document of healthcare facility standards that we use, and a lot of states have adopted different various. There's like different forms that come out, right? The different versions. So following that is really the biggest guideline. But then you also have kind of the playbook of a lot of health systems have their own internal standards too, from design and their infection control, what products they use, what equipment vendors that they prefer. And so the playbook is also to obviously consult those as well. I think it's a prescripted method, but everyone kind of approaches it maybe a little bit differently too based on the project. Yeah, I mean, it takes a whole team. It takes designers, it takes engineers, it takes equipment planners. It's a very cohesive process too to be able to design for all of those uh, necessities.
Yeah, that's fascinating. So the other one I wanted to ask is, in an environment where the codes are so prevalent, there's so much depth, and in some case, maybe it is a bit, oppressive. That's probably an exaggeration, but where the codes are very substantial, which is almost everything you do. Does it drive form at all? Like the actual form of the building, Emily? Or, can you work with form and then just make sure that everything else fits in?
So I have a preference. I think depending on who you ask, they might have different answers, but I think planning and medical planning really drives the form of design, right? And in my mind, you can't start with the exterior shape of the building without really looking in the innards of your operations and your floor plans and your interior spaces of how all of those work together. So I think it starts from the inside out like an engine, right? Versus like a museum that might be, oh, the aesthetic exterior is kind of driving some of the form inside. It absolutely is driven from the inside out if you want it to be a successful like operationally efficient. You're maximizing your floor plate, you're standardizing your clinics, your module, it's a very planning driven process. And I think that's really different. Again, we go to architecture school kind of in the top down, or you design residential firms are, like I said, some different typologies that people might gravitate towards in architecture. It is different. It's really planning driven,
All
I
right,
think.
of course, I would find that absolutely overwhelming. You have my greatest respect in the fact that you guys pull that off. It's extraordinary. Let's talk about outcomes for a minute, right? And
Sure.
designing for outcomes. What are the most important things that we can do in terms of design to improve health outcomes? Daylight, views, fresh air, those sorts of things. What are the big ones that can really have a serious impact?
Ooh, okay, that's a great question. I think, the built environment is one of the most significant impacts to, I'm going to call our social detriments of health. And you mentioned a really big one. So I think one of the most important is daylighting and views. Those are critical. And research shows that, patients in rooms with natural light and views, into nature, they recover faster. They need less pain medication. They have better sleep quality, better outcomes. There's a famous study of a gallbladder surgery patient who, those views to trees, they recovered faster than those facing a brick wall. But it's not just patients, staff matters too. And healthcare is facing a massive workforce crisis, burnout, kind of from the pandemic, but burnout is an epidemic, right? When we
Right.
design facilities with natural light and good acoustics and respite spaces, connection to nature, we're supporting the staff and public well-being too, which directly impacts the quality of care they provide. So I think that one that you mentioned is it's really key. But some other ones that, I think are really critical, I might have mentioned earlier, designing for infection control, which also became more critical than ever during COVID. You have multiple layers of protection. You have, clean and dirty flows and spatial separation. You have non-porous surfaces, and material selection is really important to withstand all the disinfectant agents, and high touch surfaces, seamless floor to help eliminate any kind of crevices where pathogens or dust and grit can hide. You have touchless technology, hands-free dispensers and surface contact points for registration. All of those designing for infection control is another, I think, layer that can affect outcomes, right? Yeah, I think those are a couple that I'm thinking of now. The other that I feel like I touch more in the real estate side now is this refurbishment and the modernization of work. So, a lot of hospitals were built in the 60s and the 70s, the 80s, and like we're running into they're functionally obsolete. And so a lot of systems are, do we renovate? Do we build new? They weren't designed for modern care delivery methods. And so, some of those upgrades like HVAC systems or transferring to single patient rooms from double, some systems are still there.
Right.
Many emergency rooms are overcrowded or undersized, and like reconfiguring their layouts are important. And so all of those from a planning perspective and a real estate perspective really impact health outcomes. Just in terms of the challenge that we do with all of this is that hospitals remain operational. And when we do renovations or when we design new, it's like incredible coordination. So I don't know if that fully answered your question, but those are just a couple of things top of mind that, for how design impacts health outcomes specifically.
Oh, absolutely. Yeah, no, that was a great answer. Those are some really good examples.
Imagine a building where natural light flows freely, solar heat gain is under control, and comfort is unmatched. With Solera translucent glazings, you can create spaces that work better, feel better, and deliver lasting value. Learn how at advancedglazings.com.
Let's talk about you for a minute. Let's go back. Let's switch back to Emily for a second. Can
Okay.
you tell us about your work with John Hopkins Bloomberg
Mhm.
School of Public Health? First of all, tell us about the organization, what it does, what its objectives are, and how it achieves those objectives. And then, of course, your role in all of this work.
Sure. Well, I am so proud to be a Bloomberg Health Fellow. The Bloomberg Health Initiative at Hopkins was created for generous donation from Michael Bloomberg to the School of Public Health to address some of the biggest challenges facing the US. And I think it came maybe 10 years ago is when the initiative started. And it focuses on addiction and overdose, environmental health, which is where I entered, I think obesity in the food system, adolescent health, and I think those are all of them. But the fellowship brings together, 50 people annually, kind of in their mid-career, with diverse backgrounds that don't maybe have a public health education or lens, or, I'm not a clinician by background or a nurse or,
Mhm.
someone who might otherwise be more traditional of that path. The idea from the fellowship is, the biggest health challenges that we face are not going to just be solved by clinicians and public health professionals alone. It requires a lot of cross-sector collaboration and I felt very honored to be one of the, I think, only architecture design professional in the part of the cohort. So, my role now is pursuing an MPH, so we get the full funded education from such a great world-class institution. So it's a huge honor, but, it's also allowed me to interface with people that I wouldn't normally get to talk with, or get to interface with as an architect. So I've really loved it. It's been awesome. It's transformed my thinking from design. My lens was design, but then I saw from my time in global health core and also designing other medical facilities at HOK, like what transformative, like we are systems thinkers and we can really influence public health in a great way. And it's allowed me to learn different frameworks, to think like an epidemiologist, to understand health system science, to see, again, I think I mentioned those social determinants of health, like housing, transportation, food access, neighborhood safety. Those are all interconnected with our physical environment. And so, as someone coming in from that environmental health concentration, I'm applying all of this learning directly to my work at Meadows and Ohly. And when we're doing a strategic plan for a health system, I'm not just talking about the real estate or market dynamics. I'm thinking about population health and disease patterns and vulnerability, climate resistance, what population health is showing us where. And yeah, so the fellowship gives me a platform to advocate for architecture's bigger role in public health. And I'm constantly bringing my cohort into conversations with architects and vice versa. So it's kind of cool to sit like in an intersection where architects typically aren't in public health, and then bring public health to architecture, which that training doesn't, I should say few have that cross training, right? So I'm privileged to be able to do that. That's where my
That's
passion is.
That's really cool. I have some background in like the tech startup IT world,
Oh,
and
cool.
they often try to create what they call collision spaces, right? Which
Okay.
is a room in, say, a tech incubator where the diversity of technical skills and the diversity of
Yeah.
life, just your worldview, will sometimes be able to create real serious breakthroughs for people. Just talking to
Yeah.
somebody from a completely different perspective just opens up these opportunities to see things in a different light and maybe bust through some walls that had stood in people's ways. So I'm guessing it probably operates very similarly in that kind of background.
I think so. Yeah.
Yeah.
And it's been exciting to explore, how we break down those silos. And, ultimately, we want to make the country, the world, the people we design for, like healthier, our population. So, we can do that. A building is a limited fixture and a great tool to do that, but there's other things that a building influences beyond just the building itself, right? So,
Yeah.
learning those lenses and being in that collaborative framework too, like you said, it helps break silos and open the conversation to make bigger impact, which is great.
I love it. I'm going to ask a just for fun question. How could, building or urban design help with the obesity epidemic?
Ooh, okay. So, it's a good question. I think if we think about all the other factors that contribute to obesity in terms of, I would say more recent in terms of the last 100 to 150 years, our more sedentary lifestyle. We're all in front of our computers all day. We're all sitting, and we don't have that same level of walkability in our neighborhoods that maybe we once did to go get our groceries, or drop off our laundry at the laundromat, or dry cleaning at the dry cleaners, right? So I think if we are intentional about planning our cities to be more walkable, or to have transit access is a big one. And not
Right.
just access to them, but equitable means by which to do it, and I think also, with the obesity epidemic, being able to just locate yourself and your home and your healthcare within, they call it like the 5 mile, or like it's like a 20-minute radius too of when you can walk, bike, work, and you can have all of your amenities within that space. I think that's a great way a planner or an urban designer or an architect or a real estate developer could think about how to make a healthier community, which can inherently combat aspects of obesity, right? I also think like inviting safe spaces, access to food. So one of the coolest things at Hopkins was I really got into food systems. Like I didn't know what I didn't know about it until I took an intro class, and food systems in the built environment, it just blew my mind. Talk about healthy communities, but I didn't have a single class in architecture school about our health systems and how our food is processed, how it's delivered, where we get it and how. And I think that's another big opportunity for the built environment to influence health and obesity specifically by what we eat and the access to healthy foods, how it's processed, where it's processed. I think those are generic to your answer, but other obesity combating things we can work towards and
Yeah.
design.
I love that. All right. There's so many things I want to cover today, Emily, so I'm going to
I know.
change gears quickly. Material choices, pretty hot topic these days, especially in sustainable design. But I'm guessing that in the world of medical facilities, it's an even hotter topic. Like, are there any materials or material attributes, I should say, that have you on high alert? That like, if that's coming into the facility, we better be very careful, or that better not come into the facility. Can you give me any examples of those sorts of, I'll just call them red flags in terms of materials in a healthcare world?
Sure. So, materials are critical in healthcare. We have to be incredibly thoughtful about the things we specify, and what we always try to balance as designers is performance and safety, cost, durability, and aesthetic. And healthcare materials have to work incredibly hard, right? I would say harder than some other materials, but we don't want facilities to feel always clinical and cold. And so we want warmth and humanity and, again, connection to nature. So, we look for materials that are a natural palette or biophilic patterns to bring that warmth, but then materials that can still meet the stringent performance standard. So, some things top of mind in terms of attributes are like cleanliness and durability. They have to withstand, I think I meant to mention this before, repeated disinfection, heavy equipment over them. What I want to say, like impact, if equipment hits the wall, like wall protection, again, non-porous surfaces that can, be cleaned and not harbor bacteria is, that's a no-go. We want to avoid porous material like that in clinical areas. We also have the off-gassing is really important. So VOCs and indoor air quality, patients already have compromised health going into these facilities, so you can't expose them to more formaldehyde, PFAS, other toxic chemicals. So we look for low VOC adhesives and sealant and things like that. And healthcare is loud. I think, alarms, equipment, overhead pagers. I think that acoustics and like sound absorption is, a direct thing that we also think about when we look at materials, as well as slip resistance, floors and patient areas, making sure you prevent a otherwise very preventable fall, that patients don't actually go to the healthcare system to get more hurt or more injured or more sick, because I think that's the rep that hospitals have, otherwise.
Yes.
And so things we can't get wrong, flooring, that has to be probably one of the most critical decisions for all the reasons I talked about. I think wall protection for the same, your ceiling systems and your procedure spaces, making sure that sterile fields remain sterile and cleanliness, and that you can support the weight of big pieces of equipment like booms. Those are all big picture things that I'm thinking about when I think of materials. And, increasingly we're thinking about, last thought on this is embodied carbon. So, what are the environmental impacts of the materials we're specifying? Can we use recycled content? Can we source them regionally? Healthcare has a massive carbon footprint. And I think one of the biggest challenges that we're going to continue to see as we develop and design these spaces is like material choices matter from a climate end-to-end perspective too of material choice. That's exciting, but it's also daunting. I feel like healthcare takes a burden in that, and they're not always great at being the most effective, I guess, in terms of reducing your carbon footprint, I should say. So that's an opportunity.
Are glare and heat problems leaving you in the hot seat? A revolutionary solution is here. Psst, it's not blinds. Visit advancedglazings.com/glare repair to learn more.
Okay. Tell us about your work with women in healthcare. What's that all about?
So I am the co-communications chair for the DC chapter of Women in Healthcare, and it's one of the most rewarding roles that I have. It's, a national organization. We're dedicated to advancing women in healthcare through thought leadership. We have mentorship and advocacy and networking. And so we have chapters now all over the country, and each one serves an incredible community of women kind of navigating their health careers. And so, I think healthcare usually means doctors and nurses, but our chapter is beautifully diverse to include healthcare systems executives, facility managers. We have some public health professionals, healthcare law and attorneys. We have strategists and even like pharmaceutical reps. So it's a really diverse and awesome group. We discuss a lot of programming and current health challenges, but it's really just an opportunity for women to kind of lift each other up and be in a space where we can support each other. Let's see, as co-communications chair, I manage all the external communications, the website, newsletters, member spotlights, trying to just increase visibility for the incredible work that women do in the healthcare space and create more opportunities for connection and collaboration. Yeah, so that's we do panels, we do, social events. It's fun. These are my people. So they're passionate about healthcare, committed to improving outcomes and support each other's success. So there's something powerful about being in a room of women who, are able to empathize with challenges that women might uniquely face in the space, like leadership and moving through your career challenges starting a family. Some of the best professional connections I've had are through this station. So it's very cool. Yeah.
That sounds really cool. Like, is there anything special that you bring to the organization as an architect?
Ooh, so I think, here's what's been cool. I bring a very different lens to the conversation for kind of the reasons that we were speaking. But, it's like when we're discussing healthcare challenges like patient experience or operational efficiency or even workforce recruitment and retention, I can help connect those challenges into the physical environment, right? So we recently had a panel on healthcare workforce burnout, and I was able to talk through how facility design impacts staff well-being, break room design, natural light, the environment, wayfinding. So, bringing some of that lens to, many of the executives in the room hadn't thought about built environment as like a staff retention strategy, right? Or when we discuss health equity, you can bring up healthcare deserts and food access, like we talked about, the transportation barriers we were speaking to earlier, or, facility location decisions, accessibility. Like these are design and planning issues that obviously relate to impact and equity. And it's really cool to be able to be in the room of, like, I guess informally or formally with like a panel, for example. But these are women making these decisions, and it's cool to be able to influence that even informally or through this organization.
Really cool. One of these days, I want to do an entire episode on wayfinding. You just mentioned wayfinding quickly, and it's honestly, it just seems like such an interesting science and art and an interesting balance, and it's so important. The regional hospital that's close to where I live is just a disaster. It's just horrific. It's very conventional, and everything it's a big rectangle with long hallways, right? The big rectangular hallway that's just slightly in from the envelope, and lots and lots of signs, and you're standing there like it's like being in the grocery aisle trying to figure out. It's just horrible.
I totally know this. Like, and then you're sitting there thinking, oh my gosh, I am so stressed. I have to get to this room, or where do I go? And I'm already like on edge because I have to be in the hospital there to begin with. Wayfinding is so critical. It's fascinating. Hospitals don't really always do it well because they're kind of, I'm going to call them cancerous in the sense that, usually it's an old facility that then a new thing got brought on whereas capital allocation can make those decisions. It's not based on the easiest navigability for anyone, right? And therefore it becomes this labyrinth.
Franken Hospital. The Franken Hospital.
Yeah.
We have to talk a little more about materials for just a second. So actually, I'm going to ask you to pull out your crystal ball for just a second here and look forward into the future. Are there any innovations in construction materials or methodologies that you believe are going to change or make really significant improvements in the way we create and manage medical facilities?
Yeah. So there's a couple of exciting innovations happening right now. I think a few that might really transform healthcare facility, or that I would love, I'm going to make a plug in. I hope we see more of this in the next 10 years, is we're starting to see more mass timber structure. So CLT or cross-laminated timber used in healthcare, and it sequesters carbon. It has that warm aesthetic we were talking about earlier. It can be prefabricated off-site and performs incredibly well structurally and acoustically too. So there's, obviously concerns about infection control. Codes aren't necessarily always written for that. And even though hospitals in Europe have been doing it for some time, it's new here for the US. So I think, properly treated sealed mass timber performs pretty well in some healthcare applications. Now, probably not all of your engine, like your operating rooms or your procedural suites, but what excites me is more of that mental benefit, the environmental impact of that. I hope, studies show that wood interiors reduces stress, right? So can you imagine like a behavioral health unit with exposed mass timber? That's a beautiful space to be in for patients to heal. That psychological benefit might be really cool. So anyway, I hope mass timber is something that we can see more of in the healthcare space. We're obviously seeing a lot more of modular and prefabricated construction. I don't think this is necessarily a new concept, but it's something that will continue to just become more refined and efficient. So we can now build an entire patient room with modules offsite and in a controlled environment, and then truck them to the site and rapidly install them, right? So there's quality control could be better, construction time shorter, hopefully redundancy and mass scale could make it cheaper with less disruption to existing hospital operations. So that's like another kind of one that I'm thinking of. And then I think obviously all the advances in technology that we're going to see too, that I think will impact the building, but it's like, I don't know maybe exactly how. So like digital twin technology. So this isn't a material, but the methodology could be like really game changing, right? We're creating a digital replica of the building or of a patient or of a living, breathing model in face, real-time data sensors throughout the facility. So like we can monitor energy performance and occupancy patterns and it's environmental conditions. So I think for healthcare, this means we can really optimize for like in real time and predict things like equipment failures or operations based on performance data. So I think that is really going to be cool for healthcare facilities. And then, yeah, I don't know. I think I'm excited about anything that reduces infection risk. I'm excited about the circular materials from rapidly renewable resources, like we said, and the smart materials. So phase changing to absorb and release, heat passively to regulate temperature would be really cool, or smart biomaterials to allow buildings to respond to conditions in real time without additional energy input. I mean, these are very futuristic looking through my crystal ball, but I think that those are all out there. And I think we're going to see more of those disruptors enter the healthcare design space. So yeah, I think that, ultimately healthy buildings and healthy planet are inseparable. So, anything that can create more humane and healing environments, and as we're moving towards those adaptive and responsible and regenerative materials and choices, I think that's cool. So those are things I'm excited about.
That's very cool. I have one last question about you. One more question about Emily. What does the future hold for you? Are you, and I think I know the answer now that I've really gotten to know you, but are you more on the governance side of things, or do you see yourself going back and getting your hands dirty with design again?
Oh, it's a good question. So what I love about my role now is that I'm doing strategic and big picture work, again, helping health systems think about their bigger plans, right? That's governance level work. And I'm not removed from the details, but when I'm developing those strategies, I don't, like where I sat before, I don't have to dig down into every single little minutia detail, right? So I love that. I think my path is headed maybe even more towards integrating public health and real estate strategy for now. I'm, again, really passionate about health equity and climate resilience. And so, the long term, I could see myself in a leadership role, maybe at a health system. I love where I'm sitting at Meadows and Ohly, and I hope to continue to grow that. And I'm also really passionate about educating the future generation. So I could see myself even pivoting into more of an academic role potentially too, of kind of training the next generation to navigate these challenges too. But at the end of the day, I think the core of me and what I like to be doing with this work is to improve health outcomes for underserved populations, whether that's at a governance level or a hands-on, motivated by design. I mean, I'm a designer, true and true. So this is a funny question where I'm like, I do really miss sometimes getting into the weeds of how does this design work? And where I sit now, I can be, what I want to say, like dangerous, like, because I know enough about the other side, but I don't get to figure out all those details anymore. So, but yeah, continuing to teach, to mentor, to advocate. I think great governance requires an understanding of those details, and great design requires strategic thinking. So,
love it. All right. We're at the part in the show where I ask my $1 million question, Emily, and it's a question that I ask every episode, and I ask my guests to answer from whatever perspective they'd like. So here goes.
Okay.
What makes a great building?
I love it. Okay. So a great building, I think, has a couple of essential qualities. So it first and foremost serves its users. And I know that probably sounds very obvious, right? But that's not always the case. And I think healthcare is where that is brought more to the forefront in my mind than any other typology. A great building is deeply responsive to the people who occupy it, not just their functional needs, but their emotional and psychological needs. I know we've talked a lot about this hour, but it means thinking about, for healthcare, a patient's family member who's been sleeping in a chair for 3 days. It means creating spaces where nurses can take a breath and recharge, so serving its users, I think, is what makes a building great. People who use the building are their experts, right? Like a building design comes from listening and not imposing. I think a lot about when we designed, when I was at HOK, the UPMC Vision and Rehabilitation Center in Pittsburgh. We worked extensively with patients who had visual impairments and with consultants like Chris Downey, who was a blind architect. We worked with clinicians and researchers, and the result was a building that works for everyone because it was designed with everyone. And so I think that honors a bigger piece of what I think makes a building great. And then I think a building that honors human dignity, kind of another lens to that. There is a quote from John Kerry that I really love and I come back to consistently. Design is dignity, and every person deserves to occupy spaces that respect their humanity, their autonomy, their worth. And for healthcare, this means making spaces feel hopeful and not depressing, not clinical in a sterile way. It's giving patients choice and privacy and not feeling so institutional or dehumanizing. And so I think my work in Rwanda really helped me kind of learn that and unlearn ways in which I designed in kind of a US context. I think a great building connects people to nature. It performs. It isn't just beautiful or meaningful, that it actually really works, both from energy and from people in it. I think a great building contributes to community. They don't exist in isolation. Just like a great building has a design team behind it that's multifaceted. Community anchors for healthcare, we're increasingly thinking about not just the places you go when you're sick, but the people that support your wellness, convening, and education. And that shift that kind of requires a different thinking about program and design. And then I think finally, a building is great that improves over time. So aging gracefully, adapting to changing needs. They become more loved and not less, I guess. When we think about buildings that have been around for decades or centuries, they've been cared for and adapted. They're useful and cherished. And so I think we need to design any building, but healthcare specifically, for that long view, and understand that these are going to be anchors to our community that also need to evolve and grow as we do. Yeah. So that's my answer. I think it's a long answer, but I think those are some ideas that I have about what makes a building great.
It's a wonderful answer, and I appreciate it. Before we go, is there any exciting news, any big announcements coming up for either you or for Meadows and Ohly that you'd like to share?
Yeah, so we have so much happening. I feel like we are just in a great way, very busy this season. So we are working on some really transformative projects right now. I don't think I mentioned this project earlier, but I'm working with Corewell Health in Michigan for a really great master planning and effort and looking at their campus, and we're helping them think holistically about all the things we're talking about, right? Their aging infrastructure, their growth strategy. And we also, we do a lot at Meadows and Ohly with Advent Health as a client. We recently completed a comprehensive ambulatory network strategy for them. And how do you optimize an existing network while planning for massive growth was kind of the question. And so that was really exciting. And what internally at the company, I'm really excited to use data in really sophisticated ways, synthesizing our utilization rates, highlighting demographic trends, looking more at the disease prevalence and physician recruitment strategies, payer mixes, competitive dynamics, especially with all the regulatory things happening in DC right now. All of this is going to create a different dynamic decision toolkit. And this evidence-based and strategic level thinking is what I'm excited about that's happening. And we're going to continue to fold it into our work. Yeah. So I think that might be it. I recently became a new mom this year, so yep. I'm navigating that. Thank you. And finishing my master's of public health at Hopkins. I was supposed to be finished last year, but my capstone, I'm excited this spring to finish. And I think that's it.
That's wonderful. Emily, this has been an absolutely wonderful conversation. I can't thank you enough for making the time to do this.
Well, thank you.
And you take care. It's been wonderful.
You too. Thank you so much, and have a good one.
You too. We hope you enjoyed this episode of Better Buildings for Humans. For more information on the world's best light diffusing and highly insulating glass glazing, please visit advancedglazings.com.